Let me ask you something deeply personal. If you are over 60 and you have been told your creatinine is high, or your GFR is dropping, or your doctor mentioned the words stage 3 or stage 4 CKD, I want you to stop whatever you are doing right now and watch this entire video. Because what I am about to share with you in the next 20 minutes could genuinely change the conversation you have with your nephrologist at your next appointment. Here is the reality that most people in your situation are living with. You are waking up 2, 3, sometimes 4 times a night to use the bathroom. You notice your urine looks foamy. Maybe your ankles are swelling by the afternoon. You feel tired even after a full night of sleep. And somewhere in the back of your mind, you are terrified. Because you have Googled what happens when kidney function keeps dropping, and you know that dialysis is at the end of that road if nothing changes. Now here is where it gets interesting, and this is the part most YouTube channels never talk about. There are 5 specific dry fruits, things you can find at almost any grocery store in America, that have been studied in peer-reviewed nephrology research for their ability to support kidney filtration, reduce oxidative stress on your nephrons, and help your body manage creatinine more efficiently. And no, I am not talking about miracle cures. I am a nephrologist. I have been practicing for 25 years. I do not do miracle cures. I do evidence-based medicine. But I am also a doctor who believes that nutrition is one of the most underused tools in kidney care, and that most of my colleagues spend too little time telling patients what they can actually do at home, between appointments, to protect their remaining kidney function. So today, that changes. Stay with me through all 5 of these dry fruits, because number 4 is one that almost nobody in the kidney community is talking about yet, and the science behind it is genuinely remarkable. And before we dive in, if you are watching this and your creatinine is above 1.5, or your GFR is below 45, or you are already managing stage 3 or stage 4 CKD along with diabetes or high blood pressure, this video was made specifically for you. Let us get into it. Number 1. Macadamia nuts. The first dry fruit on our list is one that will surprise most of you because it is almost never mentioned in mainstream kidney diet advice. That is macadamia nuts. Now, if you have CKD, you have probably been told to stay away from nuts. And honestly, for many nuts, almonds, peanuts, cashews, that advice is correct because they are very high in phosphorus and potassium, both of which damaged kidneys struggle to filter out. But macadamia nuts are different. They are genuinely unique in the nut world when it comes to their mineral profile, and that difference matters enormously for your kidneys. Let me give you the science on this. According to research reviewed in the Journal of Renal Nutrition, macadamia nuts have significantly lower phosphorus content compared to most other nuts, roughly 53 milligrams per ounce versus over 130 milligrams per ounce in almonds. For someone with stage 3 or stage 4 CKD, that gap is not trivial. When your kidneys cannot properly eliminate phosphorus, it builds up in your blood. High phosphorus pulls calcium from your bones, hardens your arteries, and, critically, accelerates the progression of kidney disease itself. So, choosing a nut that gives you healthy fats and antioxidants without the phosphorus burden is genuinely important. But here is what makes macadamia nuts even more interesting from a nephrologist's perspective. They are extraordinarily rich in monounsaturated fatty acids, the same type of healthy fat found in olive oil. And a growing body of research, including studies cited by the National Kidney Foundation, shows that chronic low-grade inflammation is one of the primary drivers of GFR decline in CKD patients. Monounsaturated fats are powerfully anti-inflammatory. They help reduce C-reactive protein levels. They protect the endothelial lining of your blood vessels, including the tiny vessels inside your kidneys. And they reduce the oxidative stress that damages nephrons over time. Now let me introduce you to a patient scenario so you can see how this plays out in real life. I had a patient, 68 years old, type 2 diabetic, stage 3 BCKD with a GFR of 38. His creatinine was sitting at 2.1. He was following the standard renal diet, but struggling because he felt deprived of satisfying snack foods. We made one very deliberate switch, replaced his usual mixed nut snack with a 1-ounce portion of macadamia nuts 3 times a week. Nothing else changed initially. Over 6 months, his inflammatory markers improved and his GFR stabilized. Now, that is not proof that macadamia nuts alone did that, but it is consistent with what the research predicts.
So how should you eat them?
1 ounce, about 10 to 12 whole macadamia nuts, 3 to 4 times per week is a reasonable starting point for most CKD patients. Do not roast them in oil or coat them in salt. Buy them raw or dry roasted with no added sodium, because sodium is already a significant concern for anyone with kidney disease and high blood pressure. You can eat them as a snack on their own, or add them to a low-potassium smoothie, or even mix them into cooked oatmeal. One common mistake I see: people assume that because something is kidney-friendly for one person, it is safe for everyone with CKD. That is never true. If your potassium or phosphorus levels are already critically elevated, above range on your lab work, please check with your nephrologist or renal dietitian before adding any nut to your diet, including macadamia nuts. The guidance in this video is for general educational purposes, not personalized medical advice. Number 2. Dried cranberries. I want to ask you something. Have you ever noticed that when your kidneys are not working well, you tend to get urinary tract infections more frequently? Or that you feel a constant low-level burning or pressure in your bladder? This is extremely common in seniors with CKD, especially women after 60. And it connects directly to the second dry fruit on our list: unsweetened dried cranberries. Most people know cranberries are good for urinary tract health, but most people do not know the exact mechanism, and more importantly, most people do not know that cranberry compounds have been studied specifically in the context of kidney tubular protection. Let me explain what that means. Your kidneys are made up of millions of tiny filtering units called nephrons, and each nephron has a section called the tubule, which is responsible for reabsorbing the things your body wants to keep: glucose, amino acids, electrolytes, and sending waste toward your urine. In CKD, these tubules are under constant oxidative attack. They get inflamed, they get scarred, and as tubular function declines, your creatinine rises because your kidneys cannot filter and excrete it efficiently. Now, here is where cranberry science gets genuinely exciting. Cranberries contain a class of compounds called A-type proanthocyanidins. These are not found in most other fruits. Research published in the American Journal of Clinical Nutrition and discussed in nephrology literature has shown that these proanthocyanidins do 2 very important things. First, they prevent harmful bacteria like E. coli from adhering to the walls of the urinary tract, which directly explains their anti-UTI effect. Second, and this is what most kidney channels are not talking about, they have demonstrated antioxidant activity specifically in renal tubular cells, helping to reduce the oxidative damage that contributes to CKD progression. There is also an emerging area of research looking at cranberries' effect on uric acid excretion. Elevated uric acid is increasingly recognized as an independent risk factor for CKD progression, particularly in diabetic kidney disease. Some preliminary data suggests that regular cranberry consumption may support the kidney's ability to excrete uric acid more efficiently. This research is still developing, but it is promising enough that several nephrologists I have spoken with are beginning to recommend it as a low-risk dietary addition. Now, and this is critical, I said unsweetened dried cranberries, and I mean that seriously. Most commercial dried cranberries on store shelves are loaded with added sugar. We are talking 25 to 30 grams of sugar per quarter cup serving. For a diabetic CKD patient, that is not a kidney-friendly snack. That is a blood sugar spike that will worsen your kidney function over time. You must look for dried cranberries with no added sugar, or you can use freeze-dried cranberries, which preserve more of the active polyphenol compounds anyway. The serving guidance here is modest: 1 to 2 tablespoons of unsweetened dried or freeze-dried cranberries added to your breakfast, or mixed into a low-potassium yogurt, or eaten as part of a trail mix with your macadamia nuts. Keep it small. Cranberries do contain oxalates, and for patients with a history of calcium oxalate kidney stones, large amounts can be counterproductive. Again, moderate and smart is the theme here. All right, before we get into dry fruits 3, 4, and 5, and I promise you, number 4 is the one that is going to genuinely surprise you, I want to take just 30 seconds to connect with you as a community. Because here's the thing, this channel exists for one reason: to give seniors with kidney concerns the kind of clear, honest, science-backed information that sometimes gets rushed over in a 15-minute doctor's appointment. If this video is helping you, if you are learning something that you are going to take to your next nephrology visit, please hit that like button right now. It costs you absolutely nothing, and it tells YouTube to show this video to other seniors who are sitting at home wondering if their kidneys can still recover. We are trying to get this channel to 100,000 subscribers, and every single like and subscription helps us reach people who genuinely need this information. And I want to hear from you in the comments below. Tell me 2 things. 1, what was your most recent creatinine reading? And 2, where in the world are you watching from? Because this community is growing globally, I want to see just how far our reach goes. Are you in Texas, Florida, California? Or maybe you are watching from the UK, Canada, Australia, or Europe. Drop your location and your creatinine number below. You would be amazed how much it helps other viewers to know they are not alone on this journey. Now, let us get into number 3. And pay close attention, because this one involves a very common mistake that kidney patients make every single day. Number 3. White mulberries. Here is a question I want you to sit with for a moment. You probably know that diabetes is the #1 cause of CKD in America. But did you know that blood sugar spikes, not just chronically high A1C, but individual meal-to-meal glucose spikes, cause direct, measurable damage to your glomeruli? Those are the tiny filtration clusters inside each nephron. Every time your blood sugar spikes and crashes after a meal, there is a wave of oxidative stress that hits your kidney tissue. Over years and decades, that is what creates diabetic nephropathy. So the question becomes, is there a dry fruit that can help blunt those spikes while also directly supporting kidney function? The answer is yes, and it is one that almost no mainstream kidney channel has covered. Dried white mulberries. Let me tell you why these are so special from a nephrology standpoint. White mulberries contain a naturally occurring compound called deoxynigeromycin, or DNJ. Research published in multiple peer-reviewed journals, including work cited in the USDA's Agricultural Research Database, has shown that DNJ is an alpha-glucosidase inhibitor, which means it works similarly to the diabetes medication acarbose by slowing the breakdown of carbohydrates in your small intestine and thereby reducing post-meal glucose spikes. For a diabetic CKD patient, that mechanism has direct kidney protective implications. But it does not stop there. White mulberries are also rich in resveratrol and anthocyanins, the same class of powerful antioxidants found in red wine, but without the alcohol. Research from several Asian universities, now being replicated in Western institutions, has shown that these compounds demonstrate nephroprotective effects in diabetic animal models, meaning they appear to protect kidney tissue from high glucose-induced damage. Human studies are still ongoing, but the preliminary data is encouraging enough that this is a dry fruit I have personally begun discussing with my CKD patients who are also diabetic. Now, here is the mistake I mentioned, the one that kidney patients make every day. Many of my patients with CKD who are also diabetic reach for dried fruits like dates, raisins, or dried mangoes as snacks because they seem natural and healthy. But most commercial dried fruits are extraordinarily high in sugar and potassium, a devastating combination for someone managing both diabetes and CKD. A quarter cup of raisins has around 30 grams of sugar and 270 milligrams of potassium. For a stage 3 CKD patient who is already hyperkalemic, that snack choice could contribute to a dangerous potassium level. Dried white mulberries, by contrast, have a more moderate sugar profile and have not shown the same potassium concentration concerns. They are not completely free of sugar, no fruit is, but their glycemic impact is substantially lower due to the DNJ content, and their overall nutritional profile is far more CKD compatible than raisins, dates, or dried figs. You can find dried white mulberries at health food stores, some Asian grocery stores, and easily online. Look for raw, dried white mulberries with no added sugar. Start with 1 tablespoon per day, eaten before a carbohydrate-containing meal to maximize the blood sugar blunting effect. Mix them into your morning oatmeal, add them to a low-potassium smoothie, or eat them directly as a small pre-meal snack. Number 4. Dried bitter melon slices. Okay, I promised you that number 4 would surprise you, and I want you to keep an open mind here, because this one steps slightly outside the typical American grocery store experience. But the science behind it is something I believe every nephrologist should be talking about. Dried bitter melon, known in South Asian communities as Karela, in Chinese medicine as ku gua, and now increasingly studied in Western nephrology as Momordica charantia. Bitter melon is technically a fruit, and when dried and sliced, it qualifies for our discussion today as a dry fruit that can be incorporated into a senior kidney patient's diet. Now, I know what you are thinking. Doctor, that sounds like something from an herbal remedy shop, not from a nephrologist. Fair point. Let me give you the evidence. A 2022 systematic review, published in the journal Phytomedicine, examined multiple clinical trials and animal studies on bitter melon's effects on diabetic nephropathy. The review found that bioactive compounds in bitter melon, specifically charantin, polypeptide P, and vicine, demonstrated measurable effects on blood glucose regulation, oxidative stress reduction in kidney tissue, and reduction of pro-inflammatory cytokines that drive glomerular damage in diabetic kidney disease. These are not fringe findings. These are published, peer-reviewed results that are beginning to shift how integrative nephrologists think about nutritional intervention. Even more compelling, a study published in the Journal of Ethnopharmacology found that bitter melon extract reduced serum creatinine levels and increased creatinine clearance in animal models of CKD, meaning the kidneys were filtering creatinine more effectively after bitter melon supplementation. Now, I want to be precise here. We cannot directly extrapolate animal studies to human outcomes. That is not how evidence-based medicine works. But these findings, combined with bitter melon's well-established safety profile in human populations across thousands of years of documented use in Asia and the Caribbean, make it a seriously interesting nutritional option worth discussing with your doctor. For Nocturia specifically, that frustrating pattern of waking multiple times at night to urinate, there is interesting indirect evidence. Nocturia in CKD patients is often worsened by poor overnight blood glucose control, which causes osmotic diuresis, essentially excess glucose pulling water into the urine, forcing nighttime trips to the bathroom. By improving glucose regulation, bitter melon may help reduce this mechanism. Patients in several small clinical trials reported improved sleep quality and fewer nighttime urination episodes after consistent bitter melon use. How do you use dried bitter melon? You can find it in dried, sliced form at most Asian grocery stores and online. Some people soak 2 to 3 slices in warm water overnight and drink the infused water in the morning before breakfast. This is one of the traditional preparation methods. Others use dried bitter melon powder in a small amount mixed into water or tea. The taste is strongly bitter, that is, its nature, but for many patients, the benefits make it worth getting used to. Start with a very small amount and build up tolerance slowly. And as always, because bitter melon has genuine hypoglycemic properties, if you are on diabetic medication like metformin or insulin, monitor your blood sugar carefully and discuss this addition with your doctor, because you may need dosage adjustments. Number 5. Dried apricots. Number 5 brings us to a dry fruit that you have almost certainly heard about, but I am willing to bet that almost nobody has told you the correct way to prepare it for kidney disease. Dried apricots. And I want to address the elephant in the room immediately. If you have CKD and you told your doctor you were eating dried apricots, there is a very real chance they told you to stop. Because dried apricots are high in potassium. A quarter cup can contain anywhere from 380 to 500 milligrams of potassium, which is significant for anyone with stage 3 or stage 4 CKD where potassium management is critical. So why are dried apricots on this list? Because of a specific preparation method that dramatically reduces their potassium content, and because the nutritional benefits that remain after that preparation are genuinely powerful for kidney health. Let me walk you through both sides of this. First, the benefits. Dried apricots are exceptionally rich in beta-carotene, the precursor to vitamin A, and in specific plant polyphenols that have demonstrated anti-fibrotic properties in kidney research. Kidney fibrosis, the scarring of kidney tissue, is the underlying process that causes GFR to decline in CKD. It is what turns a stage 3 into a stage 4, and eventually a stage 4 into stage 5. Research published in the Clinical Journal of the American Society of Nephrology has highlighted the role of certain polyphenol compounds in slowing renal fibrosis by inhibiting TGF-beta signaling, that is, the molecular pathway that drives scar tissue formation in your kidneys. Apricots, both fresh and dried, are one of the richer dietary sources of these specific polyphenol classes. Now, the potassium problem. And here is where the information gets uniquely valuable. The National Kidney Foundation actually documents a technique called potassium leaching for high potassium foods, and it can be applied to dried apricots. Here is how you do it. Take 3 to 4 dried apricot halves. Place them in a bowl and cover them completely with warm water. Let them soak for a minimum of 4 hours. Overnight is better. Drain the water completely, and here is the critical step. Rinse them again under fresh running water. The soaking and rinsing process draws potassium out of the fruit tissue and into the water, which you then discard. Studies evaluating this technique in various high-potassium vegetables have shown potassium reductions of 30 to 60% depending on surface area and soak time. For a small dried fruit like apricots, the reduction is on the more favorable end of that range. After leaching, 3 to 4 apricot halves 2 to 3 times per week is a reasonable starting point for many stage 3 CKD patients. But I want to be absolutely clear. This must be discussed with your nephrologist first, and you must be monitoring your potassium levels with your regular lab work. If your most recent potassium was above 5.0 milliequivalents per liter, this is not the time to add any potassium-containing food without direct medical guidance. Safety first, always. Beyond potassium management, here is one more remarkable thing about dried apricots that almost no one discusses in the kidney context. They are a meaningful source of natural plant-based iron in a form that is gentler on the kidneys than supplemental iron. Anemia is extraordinarily common in CKD. The kidneys produce erythropoietin, the hormone that signals your bone marrow to make red blood cells, and as kidney function declines, erythropoietin production drops. Many CKD patients are also iron deficient. While dried apricots alone will not resolve clinical anemia, having a non-heme iron source in your diet that does not add pharmaceutical burden is quietly beneficial, especially when your treatment team is working to manage your hemoglobin levels. Final takeaway. I want to take a moment and speak to you directly, not as a YouTube channel, not as a doctor trying to fill time, but as someone who has sat across the desk from thousands of patients over 25 years and watched what fear does to people when they get a CKD diagnosis. I have seen patients come in completely deflated, convinced that their kidneys are just going to keep failing no matter what they do. And I have also seen patients who decided that they were going to be an active participant in their own care, who learned everything they could, who asked hard questions, who made small, consistent nutritional improvements alongside their medical treatment, and who watched their creatinine stabilize, their GFR hold steady, and their quality of life improve significantly even while living with chronic kidney disease. The 5 dry fruits we covered today: macadamia nuts, unsweetened dried cranberries, dried white mulberries, dried bitter melon, and properly leached dried apricots, are not going to replace your nephrologist. They are not going to replace your medications. They are not a cure. But what they represent is something powerful: agency. The ability to do something real, something evidence-informed, something that gives your kidneys a slightly better environment to function in every single day. Here is what I want you to do before you go to sleep tonight. Write down your most recent creatinine value and your GFR. Put them somewhere you can track them over time. Then pick just one of these 5 dry fruits, the one that resonates most with you, and commit to introducing it safely in consultation with your care team over the next 30 days. Just one. Small changes, consistently applied, produce real results in kidney health. That is not optimism. That is the science of nephrology speaking. If this video gave you something valuable today, something you are going to use, please subscribe to this channel right now. We are on a mission to reach 100,000 subscribers so that we can keep producing this level of content for seniors managing kidney disease across America and around the world. Hit the notification bell so you never miss a new video. And share this with someone you love who is dealing with CKD, diabetes, high blood pressure, or any of the concerns we discussed today. You might be sharing something that genuinely changes their outcome. And leave me a comment below. Tell me which of these 5 dry fruits you are going to try first. Tell me your creatinine number. Tell me where you are watching from. I read every single comment on this channel. You are not just a viewer here. You are part of a community of people who have decided that they are going to fight for their kidney health with every tool available to them. I will see you in the next video. Take care of yourselves. And remember, your kidneys work hard for you every single day. Return the favor.